CEN test prep exam date. Question 1. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 2. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 3. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as option A, Gray-Turner's sign. Option B, Cullen's sign. Option C, Murphy's sign. Option D, Rovsing's sign. The correct answer is option B, Cullen's sign. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output. Question 5. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Question 6. A patient leaving against medical advice, AMA, must be informed of. Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. Question 7. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A, no tetanus prophylaxis needed. Option B, a tetanus immunoglobulin only. Option C, Tdap or TD booster. Option D, a tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, Tdap or TD booster. Question 8. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Fat embolism syndrome is most commonly associated with fractures of the option A, distal radius. Option B, pelvis and long bones. Option C, clavicle. Option D, metatarsals. The correct answer is option B, pelvis and long bones. Question 10. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 11. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is Option A, absent breath sounds. Option B, a dullness to percussion on the affected side. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. Question 12. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Question 13. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 14. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss. The correct answer is option B, diverticulosis. Question 15. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. Question 16. The priority patient for a trauma team activation based on mechanism of injury is option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Question 17. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 18. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The safe harbor provision for nurses typically refers to option A, a law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 20. A patient with a history of alcohol abuse presents confused and ataxic. To rule out Wernicke's encephalopathy, the nurse should prepare to administer option A, folic acid. Option B, a vitamin B12. Option C, thiamine. Option D, magnesium sulfate. The correct answer is option C, thiamine. Question 21. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A, the ETCO2 of 0 mmHg. Option B, persistent ETCO2 waveform with each ventilation. Option C, PTCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent ETCO2 waveform with each ventilation. Question 22. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is option A 250 ml of 0.9% normal saline, option B 500 ml of D5W, option C at least 30 ml/kg of isotonic crystalloid, option D packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 23. The emergency nurse suspects acute epiglottitis in a patient presenting with option A inspiratory stridor, drooling, and tripod positioning, option B barking cough, low-grade fever, and hoarseness, option C productive cough, pleuritic chest pain, and fever, option D a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Question 24. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A administer pain medication, option B perform a complete neurological assessment, option C prepare for lumbar puncture, option D obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 25. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to option A patients with private insurance only, option B any person who comes to the ED and requests care, option C U.S. citizens only, option D patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care.